I'm Dr. Briend. I'm a medical doctor, and I've been working doing research on child malnutrition for many, many years. When I was in Bangladesh, I did research on the association between malnutrition and mortality. There must be something like 17 or 19 million of children who suffer from acute malnutrition. The real number, we don't know exactly how many there are. Big number. At that time, WHO recommended to treat the children within the hospital with a liquid-based diet, which limited the capacity for treatment. Treating a child in hospital is always very expensive because you need a facility. It's expensive for the health system, but as well it's very expensive for the family. My contribution was, first I found that children who are going to die from malnutrition can be easily identified by measuring their mid-upper arm circumference with a simple tape. And also to develop, in collaboration with a colleague from the food industry, Michel Lescan, to develop a diet which had a similar nutritional property, but which could be consumed without the addition of water. The dangerous part of the traditional diets was the mixing of food and water, because food and water provide an excellent growth media for bacteria. If you eat them separately, if you eat the food without the addition of water, and the water is taken later, you considerably decrease the risk of accidental contamination, and then this part of the treatment can be safely carried out at the household level, at the community. And this led to the possibility of massively increasing the number of children which could be treated. The Gairdner Award is very important for me and for all people working in the same field, because it draws attention on the possibility of treating children with severe acute malnutrition easily at the community level. I think this is very important to stress. And also I think it's very important for all my colleagues and all those that I don't know who work on the same topic. I think also it's a big encouragement for them, and I highly welcome this. There are very important work going on, and I think the Gairdner Award is an encouragement for all the people involved in these research to continue further. I can say that roughly it's about 7-8 million children which are treated every year. The second part of the question is more difficult to answer. How many deaths do we prevent with this treatment? The honest answer, I think, is that really we don't know. My best answer would be quite a few, a lot. If you look at the UNICEF reports, UNICEF tried to have an estimate of the deaths averted because it's very important for them as well when discussing with donors. The producer recently a report where they estimated this treatment, community-based treatment of severe malnutrition, saves between 900,000 and 1.5 million deaths every year. Was always driven by curiosity, and I had medical training. And what maybe pushed me to do research, initially when I started medical school, I did not plan to do research. But what pushed me to do research was that very often we were told, when you see a patient with this and that condition, you should do that and this and that. But I did not get a clear answer. Why should we do it? Why do we do that and not something else? So this led me to look more deeply into some question, and this convinced me that I should start doing research.
Right.
And then during my work, yes, I did face challenge, and I think one of the problems I had is that when you have a really new idea and you want to change practice, you meet resistance. Physicians don't want to change their practice. They're used to treat patients one way, and if you try to find another way, or initially people are conservative by nature, and I had to face a lot of resistance. But eventually you make it.